Computer. Thank you very much. Welcome. This is the preparatory meeting for STI, Science and Technology Side Event, which will be on May 3rd. And I am presenting the Open Science Transformation and Essential, which is essential for health and education systems. Let me share my PowerPoint presentation with you all. Okay, here we are. At least our system is working well. Thank you very much. Open science is essential to transform health and education systems in both developed and developing countries. This will help us to achieve the United Nations 2030 agenda. By promoting science that is more accessible, inclusive, and transparent, open science often furthers the rights of everyone to share in science advancements and its benefits. Open science encourages scientists to develop tools and methods for managing data so that as much as possible can be shared and whatever is appropriate. Our vision and our efforts, let us set global standards for open science for all. In the fragmented scientific and policy environment, a global understanding of the meaning, opportunities, and challenges of open science is needed for its fair and equitable operationalization at the individual, institutional, national, regional, and international levels. The Women's Health and Education Center, its acronym is WHEC, initiatives, recommendations, written statements, and side events provide a national and international framework for open science policy and practice that recognizes disciplinary and regional differences in open science perspectives. There is a rich diversity of ways of working, which relies on a broad and open process. We aim to mobilize humanity's collective intelligence that involves youth, educators, civil society, governments, business, cooperations, and stakeholders. Bottom line, education and health transforms the world. Here is the abstract of our initiative and our side event. Open science for all is a necessity, not a luxury. WHEC, with its partners, will continue to support country actions and strengthen inclusive digital learning platforms and high-quality information worldwide. We take into account academic freedom, gender transformative approaches, and the specific challenges of scientists and other open science actors, and in particular in developing countries, and contributes to reducing the digital, technological, and knowledge divides between the countries and within the countries. The investments in STI are vital to achieve all 17 sustainable developmental goals. Objectives. As I have mentioned to you, we have very talented faculty joined us from all over the world, and the objectives of our discussion are to highlight experiences of various technological solutions in improving the affordability of quality of education and healthcare services for all. Number two, the experts and the faculty on this panel will clarify how to best apply technology in the learning process. It is the poor and marginalized in our society and in our world who have most to gain from the advances in science, technology, innovation, online learning, e-health, and sadly, at this point, they are often the groups who benefit from this least. STI solutions for least developed countries. Let's not leave anybody behind. Countries should take rapid actions towards broadband internet connectivity to their population. Last but not the least, WHEC with its partners will continue to support country actions and strengthen inclusive digital learning platforms and high quality information dissemination. Women's Health and Education Center's e-learning, e-health, and e-government initiative, improving global partnership for education and health. This was presented during 2022 high-level political forum in collaboration with World Health Organization, WHO. The aim of this initiative is to promote and build norms and standards in the health and education sectors. Diverse communities, rich in unique skills and means of production, find mutual benefit in trade and the larger marketplace it creates. But this can only be achieved through the application of common standards. International standards speak to the diversity of interconnected world, introducing uniformity at the interfaces where we need to be certain that we are all on the same terms. Standards build trust. They are at play in almost every product we consume and every process that readiness them for consumption. A web link has been provided to you in this slide, and please review it at your convenience. Technical standardization in health sector establishes norms of complex systems, and it is crucial in capturing and stimulating innovation, providing the lifeblood of research networks in reproductive health and much more. Such networks require common standards to enable interconnection and interoperability. We work with WHO and UNESCO to achieve the ultimate goal of standardization of high quality international standards developed using an open, inclusive process, meeting the needs of wide variety of industry sectors. Such applications have the potential to make invaluable contributions to our pursuit of the United Nations Sustainable Development Goal. Link Access Project. LINK is an acronym, means learning, innovating, networking for knowledge. Our initiative is accessible in 227 countries and territories. Big data management, privacy, ethics, and protection should be lawful, legitimate, and of fair use, means taking in account the interest of these individuals whose data is being used. Due diligence for third-party collaborators is essential. Third-party collaborators engaging in data use should act in compliance with relevant laws and regulations, including privacy laws, as well as the highest standard confidentiality and moral and ethical conduct. For open data, transparency and accountability, appropriate governance and accountability mechanisms should be established to monitor compliance with relevant laws and regulations, including privacy laws and the highest standards of confidentiality, moral and ethical conduct with regards to data use. We must, however, be mindful of the potential risks and issues that arise from the increased adoption of big data and AI, artificial intelligence. Achieving 2030 agenda for SDGs require all stakeholders to come together to create an enable environment for adoption of responsible frameworks and the development of inclusive tools. Research has consistently pointed out that the cost of accessing devices and broadband internet is the key barrier to connecting and the unconnected. WHEC provides free access to the least developed countries, free access in health and education sectors. Join our efforts to increase the connectivity. Science and technology gap and the future initiatives in education. Big data and artificial intelligence are leading to breakthroughs in how we can treat deadly diseases. But who really benefits from these innovations? How many of us will really benefit from this industrial revolution or ultimately really profit from it? If we are to talk about LDCs leapfrogging to modern technologies, we will have to take into account hardware as well as software issues. Although investment in technological infrastructure is a prerequisite, investing in capacity building to adapt to existing technology is just as an important feature. Our task lies in supporting LDCs in order to make access to technology and knowledge available to everyone, to unleash the potential of people's creativity and ingenuity. Uh, Lagging behind does not need to be an eternal curse for LDCs. They do not remain tied to outdated, inefficient technologies. A critical first step would be to recognize and act on the need to support this group of countries to help them catch up. And some of our initiatives are health promoting schools, programs for youth development, mental health programs to prevent gender and gun violence, and how to handle life's challenges for good mental health. These are just a few examples, and they all demonstrate that it is possible for LDCs to keep abreast of the latest advances in innovative technology. They show what public and private sector partnering and South to South cooperation can achieve, and prove that technology is not an end in itself, but a valuable enabler on the path towards achieving sustainable and inclusive development for everyone. Last but not the least, space technology and implementation of the 2030 agenda. I am sure you all are fascinated by the space technology as I am. Achievement of SDGs is a marathon, not a race. But when we are hitting a wall, game-changing innovations can help us power through with unprecedented speed and scale. In the end, here is the vision for the future discussion. As outer space is becoming more congested and contested while offering a growing pool of benefits to humanity, utilizing space contributes positively to a range of policy areas, including climate and weather monitoring, access to healthcare and education, water management, efficiency in transportation and agriculture, peacekeeping, security, and humanitarian assistance. The list of Earth impacting space application is nearly endless. and many other valuable contributions are currently in the development or being researched. WHEC's activities and new initiatives aim to employ a cross-cutting approach and use of space science and technology as valuable tools to help implement SDGs. Space for everyone. We believe since space has far-reaching applications, all countries should be supported in accessing the benefits of space-based technology that facilitates sustainable development. Join our mission. I thank you very much for listening patiently. Now I have a pleasure to hand over to Dr. Sarina Mani, who has just finished her master's in public health. She will talk about M-Health and adolescent management. Go ahead, Sarina.
Sounds good. I got a bit of a title upgrade there. But do you want me to share my own slides, or did you want to share on my behalf?
No. You share. I want to try mine. That's it.
Wonderful. Is everyone able to see these slides here?
Yeah, it's good.
Okay, wonderful. So as Dr. Luther mentioned, my name is Serena. I'm a current Master's of Public Health candidate at the Johns Hopkins Bloomberg School of Public Health. And I'm here today to talk about adolescent voices and the development of effective mobile health tools for this population. And so I wanted to start off by talking a little bit about the Armadillo study, which was a study that was conducted recently in Kenya. It was a randomized controlled trial for a mobile health intervention for sexual and reproductive health. And so essentially what the authors of this study identified was that over 33 million women and girls aged 15 to 24 in the developing world have an unmet need for contraception. And this was true in Kenya as well. And so they looked at developing a tool which would essentially help these young women and girls with any questions that they would have regarding their sexual and reproductive health. So it was this application where adolescents could write in with a question that they have that they might not feel comfortable talking to their doctor about, talking to a parent about, or a trusted adult, or they might live in areas where they don't have, those clinic capabilities. And so this study itself was very participatory in its design. And so it started out with focus groups with youth and their parents and families in designing this application. It got a lot of input on the ground, which feasibly, would set it up for success. However, there were a lot of lessons learned. So in terms of mobile phone ownership versus mobile phone access. And so one of the issues that they had was essentially the non-engagement of participants. And so even though this was something that the youth had participated in focus group discussions about, this was something that was really supposed to be tailored to their needs, they ran into a lot of concerns. And so one of those things was that people would provide, so these girls would provide phone numbers that didn't necessarily belong to them, but they belonged to maybe an adult in the family, or this was a mobile phone that they shared with a brother or somebody else in the family. And so that was a barrier to this project, given that when you're talking about issues such as sexual and reproductive health, you might not want someone else having access to that data. And so that was one of the main things that they highlighted with non-engagement of participants. And then I just wanted to talk a little bit about sort of that notion of, what can we do in areas where mobile phone ownership might not be widespread, but youth might have access to a mobile phone, but might not, own that phone. And so I wanted to talk first a little bit about stigma. And so this is a study that was conducted out of Canada, talking about help-seeking behaviors of youth and some of the barriers there. And so this one, this quote focuses on schools. And I'll just read it. It says, with schools, talking openly about mental health is important because guidance counselors for me have just been like, you are doing bad in science and that's why you're sad. And so when we think about this particular youth and we think about health promoting schools, how do we create schools where adolescents feel comfortable, talking about mental health issues that they might be facing, talking about sexual and reproductive health issues, and, how do we really work to sort of remove the stigma surrounding these concerns worldwide so that, interventions can be more successful, especially when they rely upon other adults and providers. And so this was another quote from the same study. A lot of doctors do not know how to talk to trans patients, which leads to a lot of stigma. And I've had things that I've been going through blamed on my gender dysphoria. And so I wanted to highlight this quote as well because, providers might be faced with youth coming from a wide host of backgrounds, and they might not be familiar with how to deal with these sorts of issues and how to address them. And so that can also lead to a lot of perceived stigma on the part of adolescents. And so how do we start to, combat some of these almost, unmeasurable forces sometimes that might be stopping youth from engaging in interventions to the best of their ability? And so here, I just wanted to talk a little bit about some things I touched on earlier in terms of protecting the right to education, promoting mental well-being in schools, providing that agency around contraception and childbirth. So when these interventions do come into communities, youth know that these are interventions where they'll still be accepted. They feel comfortable engaging in them. They might feel comfortable, having a trusted adult who can help mediate this relationship with this mobile health intervention where they, are not required to sort of solely depend upon themselves in order to engage with these health tools. Which brings me to allowing adolescents to advocate for themselves as well. And so they did a fantastic job of this in the Armadillo study and really getting their input and thinking about what are the needs of the community and the young women and the young girls in those communities. And then I just wanted to highlight this next quote as well from that same study out of Canada, where this girl says, or young person says, but to me, it just feels like the stigma I face is like, well, put on a good show and maybe we'll help you if we have the space, if we have the funding, or if we have the room. And it's really humiliating. And so here I wanted to focus a little bit about how oftentimes young women and girls who are in settings where they might experience a lot of stigma, whether that be self-stigma, public stigma, surrounding these issues such as sexual and reproductive health, which I know, Dr. Luther, you had talked about earlier in terms of menstruation in India, and how sometimes these topics can be really hard for youth to bring up. And so thinking about mobile health tools and how they can really come in that space, and they can be this sort of, almost neutral force in youth's lives, where they can get information and they can ask questions that they might not feel comfortable asking face to face with their providers or with their teachers or with trusted adults. But part of the issue there is that it has been observed that digital mental health technologies can potentially increase the risk of stigmatization for young adults and children, especially when we're thinking about data exposure and things like that. And so going back to the Armadillo study, which I was talking about, I think too, one of those ways to reduce that harm is to mediate this. And so, we think of technology on its own as not potentially being enough. And we think as, teachers, educators, providers saying, okay, they're doing the best they can as well. But, how can we bring those two sort of sides together and really build tools that are integrated with providers, with teachers, with trusted adults, and that youth can also rely on and trust and sort of reduce this risk of harm through these applications by really having that sort of two-pronged strategy. And so thinking about what youth want to use mobile health for. And so information gathering, social support, inspiration, tracking behaviors and health goals, these are all sort of, very almost straightforward uses of technology, right? There doesn't need to be a lot of bells and whistles. But one of the things that has shown a lot of promise recently is, how do we encourage youth to engage in these behaviors along with, potentially their providers? Can they use these applications to check in with their providers, for the providers to motivate them around some of these topics, or even just a family member? So if they have access to a family member's mobile device, maybe this is something where young girls in partnership with one of their parents or a sibling can set these goals, can work towards these goals, can get their questions answered around access to contraception and things like that, or find out where there might be a mental health provider. And oftentimes when youth rely on the adults in their lives to maybe take them to the clinic and things like that, we want to make sure these solutions are really integrated. And so that brings me to recommendations. So what can you do today? I just wanted to highlight the importance of really bringing adolescents into spaces where they might not, generally have the places to share their opinions. And so thinking about, how do we create a more equitable world where we're not discriminating on the basis of race, ethnicity, gender, sexuality, but also, very critically age, right? And so just because adolescents have still developing brains doesn't mean that they don't have a lot to offer when it comes to developing interventions such as this. And so that brings me to what can we all do tomorrow? So advocating for youth voices in mobile health development, training providers to center youth as experts with their own experiences. And so, that's how we start to break down some of these barriers, such as stigma, such as all of these other things that we talked about, where oftentimes youth are not operating in a vacuum and they don't have the opportunity to take, full advantage of some of these tools on their own. And so, lastly, considering mediating the digital solution adolescent pathway with a trained provider and or trusted adult, so that there's accountability, there's this sort of another force of non-judgmental wisdom, and then, this digital health application is working in tandem with somebody else in the youth's life that, and that together they can just be more effective and better equipped to tackle all of the issues that youth today face. So that was all I had for today. If there are any questions, happy to answer them. And thank you, everyone.
Thank you, Sarina. It was very enlightening, and you did a good job in putting it together. Roger, you wanted to share your wisdom with us, so go ahead.
Thank you, Rita, and thanks, Serena, very much for your talk. Oops, I lost it. I had it, and then I lost it. Just give me a moment. Okay.
Yes.
Just run it with the slideshow itself. So I go full screen. Sorry, the bar is in the way and I can't click on it. So then find it. Oh, this is just a minute. There we go, from the beginning. Okay, so I want to talk about some of the practical issues around implementing technologies, particularly in developing countries. So that's my focus. My background is as a consultant in ethics and global health. I'm formerly a member of faculty at Yale School of Medicine, and one of my current roles is as co-chair of a UN group, or it's the Higher Education Sustainability Initiative, the Publishers Compact Fellows group. So that's my background. And in terms of the development goals that I'm going to cover today, I'll be focusing on 3, 4, and 10, and these deal with health, education, and reducing inequalities. Now, in terms of new technologies and sustainable development, new technologies have tremendous potential, as we've already been hearing, in terms of advancing health and promoting education and equality of opportunity. For example, telehealth has a number of different applications, and since COVID, we've learned much more to make much better use of this. Artificial intelligence is very much a topic for discussion at the moment, although I think its potential is still yet to be explored. And remote learning and the democratization of knowledge can certainly be facilitated through e-learning, increasing access to higher education, reducing the need for travel, which promotes sustainability, lowering costs and reducing carbon footprints. So there are a number of positives, but we also need to think about the ethical considerations because these are important. For example, if we go headlong into adopting AI, artificial intelligence, we must be aware of the fact that there are hazards, there are moral considerations that we need to take into consideration. For a start, who controls the technology? what happens if the technology fails? If somebody starts to depend on that technology and then for some reason it fails, or somebody is unable to access it? And who is monitoring the safety and quality of content, if anyone? Very topical issue at the moment. And the last one I particularly want to focus attention on is really who stands to benefit and derive the most benefit. Is it the service provider or the end user? Because sometimes with the new technologies, there are enormous riches to be gained by the people that own the technology. And although the end user may derive benefits, it may result in inequity. So what are the limitations that we need to be aware of? Remote healthcare restricts the ability for physical examination of a patient and human-to-human contact, which is part of the practice of medicine. And in terms of AI, AI cannot make moral judgments. It can accumulate a lot of data, but it is not capable of that high level of reasoning, although there are some who argue that it can or that it will. But we need to be aware of it as a limitation. And again, the last bullet point here, I think, is perhaps most important, because it is very easy to replicate inequalities in the physical world and in the digital world. And I'm not saying it's easy to counter that, but we must be aware of that limitation. So in terms of inequalities, within the context of global health, it's currently getting a lot of criticism for perpetuating colonial policies and for making rich countries richer, which is not helpful. And I've given an example here because I've done a lot of work with medical students, and most medical students in their final year go off and do a clinical elective, and students often travel around the world when they're doing this and do a short-term project for a few weeks, and then they pull out and leave. And the question is, for whose benefit is this? Does it produce any benefit in the local communities? Or is it all about take for the medical student without really the process of give and take that provides an ethical yardstick, if you like, for assessing the validity of the exercise? And I've worked with a team of researchers, and we've written about how these electives can be run ethically. So let's go back to considering the potential for applied technology. Because if these issues are properly addressed, there are a number of benefits that can be to the advantage of developing communities. Quality healthcare interventions can be made accessible that might not otherwise be possible. Digital learning could be accessed, in allowing more equitable sharing of knowledge and research. And in terms of higher education, the technology, intelligent use of applied technology with regard to the ethics has respect for knowledge production, and the outputs should be searchable, they should be acknowledged, and as all contributors, because very often in global health, a lot of the contribution depends on input from people in the local communities. They don't always get the acknowledgement that they deserve, and researchers from low and middle income countries are not always properly rewarded for the work that they do. These are important considerations. We talk about discrimination as if it's a bad thing, but there is such a thing as good discrimination. I mean, after all, we teach our children the difference between right and wrong, but there are other ways of applying this in adult life. And I think one yardstick that we can apply is, does discrimination draw a distinction between actions that promote the public good and those that do not? And that really relates back to my previous point about who stands to derive the most benefit. And if technologies benefit poorer societies and the less privileged, for want of a better expression, that can certainly work if the technologies are well designed, if they're genuinely accessible, and in that way they can help to promote more equitable distribution of wealth, knowledge, education, and resources. And I will stop there. Thank you.
Oh, thank you, Roger. It was quite informative. I think we have somebody from UNICEF India. Let me